kujua jinsi ya kutunza hawa watoto, kutunza mama, na labda yale mambo ambayo lazima tuyazingatie kuhakikisha kwamba hata huyu mtoto anazaliwa akiwa na afya. So today we are here, tunaangazia how to care for a newborn. Kwa hivyo nawe nakualika tu ndani ya nyumba kwa 22914 na pia kwa Facebook page yetu Mwangaza TV, Celestine Waka, the favored in the house, na niko na Daktari Chege. Karibu sana daktari ndani ya nyumba.
Asante sana Sele.
Wow, karibu sana. Hebu jitambulishe kwa sababu najua kuna watu ambao wanataka kujua huyu Daktari Chege ni nani.
Okay, asante sana. Kwanza ni salimie mtazamaji wetu.
Yes.
Na full name naitwa Dr.Chege. I work for the Kiambu County government.
Yes.
Allow me not to mention the specific hospital because the standards of care are standard for the whole of the Kiambu counties.
Yes.
County hospitals. So huko ndiko nafanya kazi. Na karibuni sana na sana tena. Then as we look at newborn care.
Alright. So na wewe ukiwa pale nyumbani utasema nasi kwa 22914 na pia kwa Facebook page yetu Mwangaza TV 22914 na pia kwa Facebook page yetu Mwangaza TV ya streaming live, hata kwa YouTube channel yetu Mwangaza TV Kenya. Ukiwa na maoni, uko na mapendekezo, una swali, daktari yuko ndani ya nyumba kuhakikisha kwamba hayo yote nayo yanajibiwa. So daktari, hata kabla labda hatujafika pale ambapo tunasema mtoto ndio huyu amezaliwa, tunataka kushughulika, tunataka kumtunza, tunataka hebu kidogo tu iko sawa. Daktari ndio huyu, mtoto ndio huyu amezaliwa, tunataka kumtunza, tunataka kuhakikisha kwamba mtoto wetu yuko sawa. How do we get there? What are some of the things you should do before we get there?
Okay, thank you. Kwanza, kabla mtoto azaliwe, amebebwa na mama.
Yes.
Kumbuka kwamba mama anakuwa na ujauzito for 9 months.
Yes.
So we must optimize maternal care.
Yes.
Tuhakikishe kwamba huyu mama wetu ako healthy.
Yes.
Mentally, psychologically, physically. So mentally sasa ni ile environment ako na psychologically. Physically ni kwamba tunaenda antenatal care.
Yes.
Tunaanza mapema. In fact, we should start antenatal care before we conceive. We do yes. Kabla ujifungue, kabla ubebe mimba, uanze pre-antenatal care. Uende ukaguliwe na daktari, make sure your health is optimal. Kama wewe ni mtu wa diabetes, sugars are controlled. Kama wewe uko na pressures are controlled. Kama uko na shida nyingine yote, it's optimally controlled. Then uconceive. Ukianza kuconceive, unaanza clinic, unafuatilia tu, sababu kuna supplements ambazo tunapenda kupatia wamama. Of importance, IFAS. IFAS ni folic acid, inasaidia development of central nervous system, hiyo ni brain. Alafu FAS, hiyo ingine ni iron. Iron, hiyo inasaidia level of blood. Alafu we give specific care depending on the mother. So usually we say we have 4 focused antenatal visits, at least 4. But you notice some mothers will do more, especially the high risk mothers. So we space them depending on trimester. So we optimize antenatal care. Alafu kitu cha muhimu kingine ni kwamba ukijifungua, you must be attended by a skilled birth attendant. Usually in short, midwife.
Yes.
A trained midwife, yes. Yes.
Na sasa kuna wale ambao wanasema, ama kuna wale wanatazama na wako katika maeneo ambayo labda kufikia hospitali ni mbali, na wako na wale midwives amongst themselves ambao wanawasaidia labda kujifungua wakati unapofika. Labda kabla hatujavuka, tungegusia tu some of the precautions even the midwives need to take kuhakikisha kwamba hawa watoto wanazaliwa wakiwa na afya bora.
Okay, the most important bit is, I think the places without hospitals, they are government initiatives, both national and county, that ensures that the birth attendant has at least basic health education that they need for that specific mother. Like they are high risk mothers. Mama ambaye anakuanga na mashida akijifungua, that's a high risk mother. Mama ambaye amejifungua kwa kupasuliwa, they are high risk mother. Mothers with medical conditions, they are high risk mother. Mothers with precious babies. Okay, number one, don't take me badly, all children are precious. But kuna mama pengine amepoteza watoto, wengine they are special children. There is that focus that we focus on those mothers that we really want to make sure this child is optimally. But for all newborns, they are all precious to us, and we want to make sure they are well born. But there are those specific groups that we call high risk mothers. So how kila mtu mwenye anazalisha na especially those areas that don't have many facilities, usually they are given training by the government. Wanaenda tu wana register, wanapelekwa, wanatrainiwa, so that at least they are a filter.
Yes.
But still, we recommend that they make arrangement for the mothers to get to the delivery centers on time.
Yes.
Yes.
Yes. Wow, asante sana. So, tumefika kile kitengo ambacho mtoto ndio huyu anazaliwa. So we want to care for this.
Okay, so we've talked about the optimal health of the mother.
Yes.
Sasa cha muhimu sana ni kwamba our neonatal mortality rate, the deaths,
kiwango cha vifo,
tuko 21 in 1,000 live births. That is very high.
Yes.
Na bado tuko chini ya world. You know, world is combination of all developed and undeveloped countries. World, we are at 18. So we still have a way to go. Na pia sisi Kenya, we've really developed. Hatuwezi hesabiwa kwa hizo nchi tulikuwa tunahesabiwa kitambo. So we really want to do far much better than the world levels. In number 2, we don't want complications. Complications that come around like cerebral palsy, neonatal meningitis, neonatal acute kidney injury, and many other complications. That's why we want this baby to be born in optimal environment. Yes. The mother has to be healthy, and they have to be born at the right place. So kitu cha kwanza is warmth. Tushaongea kuhusu antenatal care na anajifungulia hospitali, but immediately tunazaliwa. Newborn is kenye kamezaliwa, katoto kenye kamezaliwa hiyo time. So huyo mtoto mwenye amezaliwa hiyo time. Number 1, we need to make sure that child or that baby is warm. A newborn, we call them neonates, proper medical term. A neonate ama mtoto mwenye amezaliwa hiyo time anahitaji kuwekwa at temperatures between 36.5 to 37.5. That is number 1. That baby needs to be kept warm. Number 2, anahitaji kunyonyeshwa within 1 hour of delivery kama hana shida yoyote. I'm not talking about preterms. Preterms ni wenye wamezaliwa kama hawajafika. I'm talking about a baby that is born at term. Na wamama wengine watashangaa, what is this term? Term ni mtoto ambaye amezaliwa at 38 complete weeks. Kuna vile tunahesabu mtu akishaanza clinic 38 complete weeks. So wale wamama ambao mnaenda kupasuliwa for whatever reason, especially the electives, the electives do not want to be delivered before 38 complete weeks, not unless there are complications. Unajua kuna mama mwingine atakuja kwambia nimechoka na mimba, bla bla, na nikudanganya tu anakudanganya ndio apelekwe electives yes mbele. Not unless for medical reasons. Do not lie the time.
Mwalimu, daktari, samahani, kabla hatujasonga kutoka pale, what happens wakati ambapo mtu anajifungua mtoto, let's say at 36 weeks?
Huyo mtoto hajafika, so atakuwa na shida nyingi. Kupumua is number 1.
Okay.
Breathing is a problem. Sababu, why is the child still in uterus? Sababu anahitaji kudevelop to a certain level kwamba akizaliwa ataweza kuendelea na life, ata breathe vizuri, atanyonya vizuri. So kwanza ku breathe is a problem. They cannot breathe well. Number 2, hawezi kunyonya vizuri. Number 3, there are still things they need to get from the mother until they are born. Hajapata hizo, so we need to supplement. And there are high risk of infections from meningitis, neonatal sepsis, to ingine tunaita necrotizing enterocolitis, neck. So we do not want children in affect the GIT system, ile njia ya kusiaga chakula. So if they get an infection of the intestines, it is usually a bad omen. Hiyo tunaogopa sana. So mtoto ambaye hajafika hata pumua, so atapata respiratory distress syndrome, atapata neck, atapata sepsis. Sepsis is just infection of the blood. Out of nowhere, anapata tu infection. Kunyonya hataweza, so it's a very complex baby. So if we can avoid kujifungua kama hajafika, that's what we want. So please, when you're an expectant mother, usiseme nimechoka na hii mimba. Kama daktari hajasema huyu mtoto ni wa kuzaliwa mapema, wacha amalize 38 complete weeks. No complications, no issues, 38 complete weeks. Labor ikikuja mapema, there's nothing much we can do. And there are medical conditions that will not allow us to go to that level. So there's nothing much we can do because those are medical conditions that warrant delivery before. So tumesema kuhusu warmth. Tukitoka kwa warmth, mtoto anafaa kunyonyeshwa within 1 hour of delivery, as long as is a normal child.
Yes.
A normal child akizaliwa atalia immediately. Na atalia vizuri, hata wewe mama utasikia is a good cry. Except for wale wamesedetiwa. You know, there are mothers who are going through CSs and we put them under general anesthesia. But mtu wa spinal, mtu wa kujifungua kawaida, utasikia tu huyo mtoto amelia na amelia vizuri. So that's a normal baby. Within 1 hour, akipanguzwa, akatwe kitovu, arapiwe vizuri, akipiwe warm, then within 1 hour we should initiate breastfeeding.
Yes.
Then the other thing we do is for all newborn we do cord care. Unaona pale kwa kitovu, kuna dawa ile tunapaka, the hospitals will provide. They should teach the mother how to apply it. Sorry, I forgot to carry a sample. They should teach the mother how to apply it. Anapakwa akizaliwa na anapakwa every day once. Mara moja tu until 7 days ama kitovu kianguke. Hiyo ni ile ya kupaka. There are others that they have been using hapo mbeleni kama surgical spirit.
Yes.
I know some people still use it, but the recommended one from the government inaitwa okay, let me remember the correct name.
It is okay.
But it's a ni ka tube tu.
Yes.
Kakufinya. Unapaka mtoto. Alafu unapaka once pale kwa kitovu, but you should be taught by the midwife how to apply it or your caregiver. Na si ya kuweka kwa macho. Hiyo tusichanganye. Hiyo ya kupaka kwa kitovu sio ni tofauti, isiwekwe kwa macho. Ingawa most of the hospitals have ile ya kufinya, isiwekwe kwa macho. Then kutoka hapo there is eye care.
Maybe tukiwa pale bado, pale kwa kitovu, what normally happens, unapata kwamba kuna mzazi ambaye ndio tumezaa vizuri, alafu hicho kitovu kikikatika unaona kwamba kimesalia, kitovu kinabaki kiwa kikubwa na wengine vinaingia ndani. What really happens? Is it a mistake by the mother ama ni maumbile?
Okay, hiyo dawa inaitwa chlorhexidine, nimekumbuka. Chlorhexidine digluconate. Haya, kitovu, kuna shida za kitovu za maumbile. Kuna kitu tunaita umbilical hernia. Umbilical hernia ni kwamba ngozi iko sawa, kitovu kitakatika sawa, hakuna infection, but mtoto especially akilia unaona
inafura.
Kuna uvimbe, kuna fura. Akitulia inarudi. That's just called an umbilical hernia. It's a problem. Okay. We correct it over time. But there is omphalocele. Kuna ile sasa hiyo ngozi haiko. That one should be sasa kwamba mtoto akikohoa hivi ama alia unaona matumbo yote nje. That is a medical emergency. Hiyo inafaa kutibiwa immediately. Mtoto akizaliwa tu hivi, it's supposed to be corrected. But umbilical hernia, sometimes it takes time to be corrected.
And can it heal on its own?
Most of them reduce in size, but they don't completely close. So usually, tunawatuma nyumbani, but through the surgical clinic. Then we tell them, mtoto akifura hapo na isirudi ndani is a medical emergency. But as long as haijafanya hivyo, we give them kidogo time to grow a bit, ipungue kidogo, then we treat. But omphalocele, ile kwamba unaona matumbo nje, that is a medical emergency. Yes.
All right. So we continue. Tuende sasa kwa macho. We are caring for our newborn. Tunatunza huyu mtoto ambaye tumempata, tumezaa.
Haya, kwa macho tuna apply ile dawa inaitwa TEO, tetracycline eye ointment. Pia ni ya kufinya, but don't confuse the two. Ya kitovu ni ya kitovu, ukiweka kwa macho is not good, it's dangerous. But ya macho ni ya macho. All newborns kwa macho yote mawili tunapaka ile dawa inaitwa tetracycline eye ointment. Kwa sababu we prevent complications of eye infections, especially zenye zimetoka ndani ya tumbo. Hey, number 2, at the same time we teach the mother's eye hygiene, how to clean the eyes on daily basis.
Yes.
Kila kitu kingine tunafanyia watoto, tunawapatia vitamin K. Hapo awali tulikuwa tunawapatia mpaka orally, but the recommended one is IM. IM tunamdunga kwa thigh. It is just 1 dose for all newborns. We want to make sure before they are 2 weeks we give them. Yes. Kila kitu kingine tunahakikisha kwa mtoto ni kwamba anapitisha choo. Choo cha mtoto wa kuzaliwa ni meconium. It's greenish darkish in color. And they pass many times. Kutoka hapo wakinyonya vizuri na change color inakuwa yellowish. And then they are passing urine. We are keen to make sure they pass even that first stool within 24 hours of birth. And then urine within 24 hours of birth. It's important because kama hawajapitisha, there are things we are starting to think about. So mama kwanza, ukijifungua sio kukaa tu umefurahishwa na mtoto. Nyonyesha mtoto wako, uone kama ananyonya vizuri. Pili, tuangalilie kama anaenda choo. Then hakikisha amefanywa hiyo mambo. Then in terms of vaccines, kuna zile tunapeana within 2 weeks. You know, we have a vaccination program for our Kenyan children. We start it at birth. We give BCG, ile ya prevent TB. Now we give OPVO, oral polio vaccine. O is because it's at birth, but we give them within 2 weeks, within a span of 2 weeks. Even vitamin K, we make sure within a span of 2 weeks, we give. There are other children, we want to give supplements. The preterm children, after we support, they are breathing well, we are feeding them well. Most of them will not breastfeed well at around that time. We keep them warm. Those ones we use kangaroo mother care and the incubator. At a specific time when they are stable, they can feed well, we want to send the mother home, we put them on supplement. All preterms, we want to make sure we give them vitamin D3, we supplement calcium, we supplement iron, and then we supplement folic acid. For all preterm newborns, and we don't stop, we do it at least 1 year. At least 1 year, so we don't stop. Ni kitu tunaendelea. But preterms is totally different care, but it's good we notify the mother. Especially the mother who have multiple births, they have complications. It is good to know that preterm children, yule mtoto yeyote hajafikisha 38 complete weeks. Na hata mwenye amefikisha 38 complete weeks na ako underweight, below 2 kilos. We want to make sure that we supplement folic acid, we supplement iron, we supplement vitamin D3 and calcium. And we just don't do it one day. It's a continuous process. And then they're followed up. Sasa kutoka hapo, we just follow them up. We just follow them up in the clinic and we make sure they're adding weight on well. The mother will know the child is adding weight sababu anaenda clinic at least every month. Then ananyonya vizuri, anaenda choo vizuri, anakojoa vizuri. So maybe from there, the main other things I will touch is the integrated care of the newborn. Because it's important. Wazee wengi wetu, they are very supportive. But wao wanajua kazi yao ni kuenda, nikuja na diaper, nikuja na chakula, nilipe rent. But we just want to be very keen to make sure that the mother is healthy and the child is healthy. Because if the mother is not healthy, the baby will not be healthy, obviously. Huyu mzee ama watu wenye wana surround huyo mama wanahakikisha kwamba the mother is feeding well. Kumbuka tumesema breastfeeding. We want breast milk, not unless there are other factors that are preventing that, which I will not touch on today, but we just want breast milk. Hatutaki vitu vingi, ni maziwa tu ya kunyonya from birth to 6 months. Number 2, we need to make sure we have enough supply of that milk, and that is from the mother. So mama mpaka kwanza afidiwe vizuri. The mother has to be happy. Sababu if the mother is psychologically stressed, the milk outlet will not come. Maziwa itatoka. Number 3, hatutaki mama apatane na complications zingine za delivery. We don't want her to be sick. Hatutaki akuwe na ugonjwa wowote. Nakumbuka wengine walikuwa tu na mashida. Kuna mwingine alikuwa na pressure iko juu, kuna mwingine alikuwa na diabetes, kuna mwingine ako na shida zingine, kuna mwingine amepasuliwa. So the person who makes sure that this mother is well is the people surrounding her, starting with the husband or her spouse. So just make sure the mother has fed well, has gone to her clinics, is on proper management. And after some time, we also want that mother to space her babies. So make sure at the right time she has started her contraceptives. Yes.
Kuna swali hapa, daktari, let me just 22914 na pia kwa Facebook page yetu Mwangaza TV ninafungua hapa. Kuna swali ambalo dadangu anauliza kwamba how do you control the numbness along your scar?
Okay, there are 2 types of scars. There's the old scar called sumis, umbilical incision, and there's fan and steel. Fan and steel is just the one at the bikini line.
In your cesarean, around your cesarean scar.
Yes. So most of the time you feel numb, especially post-delivery. But by the time you're 6 weeks, 3 months, it should be minimal. So if it's still persistent, you just come see us. We assess if there's a problem with the wound. If there's no problem, we'll give you something to take orally and something to apply.
And then how long does this wound take to heal? Especially kwa wale mama ambao wanajifungua kwa njia upasuaji.
There's physical wound healing ukiangalia na macho imeheal. That one doesn't take long. Within 6 weeks, it shall heal.
Yes.
The uterus goes back to the normal size within 6 weeks.
Okay.
And the mother can conceive as early as 4 weeks post-delivery. So it's good they begin. If you want to space your birth, and especially for the CS mothers, it's important you start your contraceptives early. If you have not received your first period after you delivered,
yes,
within 6 weeks, you should start your contraceptives. But the reason why we want them to be provided by the healthcare givers, we want to preserve milk. Remember, I've said this baby is breastfeeding until 6 months.
Yes.
Tunataka ile tutakupatia haitapunguza maziwa, haitasumbua maziwa. And then the wound takes time to heal, because remember, for the baby to come out, we cut the skin, we separated the abdominal wall muscles, and we cut the uterus.
Yes.
So the minimum is 6 months. 6 months, but physical healing, utaiona, even after 2 weeks, wound imeshikana vizuri, but haija heal ndani, ni ngozi tu imeshikana. The uterus has a wound, the muscles were separated, so we need time for them to come back. But the uterus goes back to its normal functioning at 6 weeks.
Okay.
A maximum of 6 weeks, so that mother can easily conceive at 6 weeks. So it's good, especially for the CS mothers, you space your deliveries.
All right. Please, daktari, zungumzia hili swala. Tuliambiwa kwamba when you breastfeed, hauwezi pata mimba. How true is this? When you fully breastfeed, unanyonyesha mtoto wako. How true is this?
Okay. Let me just explain a little bit.
Yes.
When you breastfeed, there's a certain hormone you produce.
Yes.
That is supposed to make sure you don't conceive, which is progesterone. But what percent of women does it work like that? Most women do not reach that level to prevent conception. So we want you to breastfeed, but we want you to make sure you don't conceive early. Like I've said, some women will just conceive today, and on the 3rd, 4th week, they have their menses.
Yes.
To mean the normal cycle is back.
Yes. Yes.
That means they can conceive as early as 21 days. 21 days,
wow.
28 days after delivery, whether it's CS or normal. What I would advise the mothers is I would not wait, because the experience I have with those mothers, they will tell me, mimi nilijifungua, kwanza ni CS, mimi nilijifungua, and on the 2nd month, I was pregnant. So let's just be honest, because we cannot monitor. It's true, breastfeeding is supposed to prevent conception.
Yes.
But it does not do that always. And for majority of the women, they will still get their cycle as early as 4 weeks, 3 weeks, 6 weeks after they delivered. So to make sure you don't conceive back to back, on your 6th week, if your periods have not come or have come, start contraceptives. When they just come, start contraceptives. The contraceptives we give, we explain to you. If you get a good caregiver, they will explain to you, hii utakunywa hivi, haitapunguza maziwa. Because now we want to make sure for those 6 months, the baby has enough milk. Yes.
Wow.
So they should not be worried. But hiyo ya kusema unanyonyesha ndio conceive, that one I can guarantee. Majority of the women,
they will conceive.
They will conceive.
Okay.
Yes.
Now, daktari, there's always this issue. Once someone has given birth, unapata kwamba these mothers, especially the new mothers, they are likely to fall into depression, ama wanakaa tu, yani wamechanganyikiwa. How do we help, or how do we control this?
Okay, like I said, it's just making sure that that lady is healthy. A new mother, or most of the time is a new mother, or a mother who has difficulty situation, especially difficult pregnancy, loss of a baby, a loss of other babies, and the senior aged mothers, we call them elderly mothers.
Yes.
They get something called postpartum depression and postpartum psychosis. It's, first of all, the changes of hormones is a risk factor.
Okay.
You're changing one hormone, another one, just to accommodate this baby.
Yes.
Normal state. Then you carry pregnancy, there are new hormones that are made in your body. Then you prepare to deliver the other hormones that are added. Then you deliver the other hormones that are added. Then you want to produce milk. So just the changes in the hormonal levels will cause depression. But also the stressful state. Remember, this mother, especially the first-time mothers, has never delivered. So there are so many changes, physical changes, psychological changes. And then again, most of the time, you needed to hang out with your baby, but you're pregnant, you're taking care of yourself, you're tired, then you go through labor. Labor is also a bit exhausting, or even if it's that serious. Then you have to breastfeed and you have new responsibilities. Remember, this mother has to take care of herself and the newborn. So that's what happens. And then also their social stressors. Maybe during that pregnancy, many stressing factors came in. Maybe some people, even their spouses, take off when they're admitted in hospital. Maybe there's loss of a loved one, there's loss of a job. There are many things that happen. So what I can say is the person who notes the psychological changes or the behavioral changes of this mother, number one is the midwife. Immediately at delivery. Number two is the close relative, the spouse, the neighbors, and especially in town setups. We need to keep on watching each other. So just go visit your friend if she has delivered, call her, find out how she's doing, so that you can change her, you can note her pattern. Then they change habits. You'll notice she was a happy girl, she has started being moody. You'll notice she was a very clean girl, she's not even taking care of herself. So you'll notice many things. And these are bound to happen because there are new changes. Even the senior aged mothers and the ones that have stressful pregnancies. The hormonal changes, the stressful situation, the physical changes, all that will make sure will predispose this young mother or whatever state of mother is to get postpartum depression and psychosis. They just behave differently. Depression you might not notice. Psychosis you might not because they are major alteration of the normal habits. You'll note they're annoyed, they're screaming, they don't want to take care of the children. But depression, postpartum depression, you might not notice if you're not keen. So you have to change. You have to be very keen. Check even the slightest of the change. The mood is depressed. She wants to sleep all the time. She's not having interest in the child. And she's not taking care of herself as usual. Those are subtle features. But they can be prevented, like I said, if we integrate the whole family unit into taking care of this baby. Then you bring them to hospital early, we start them on treatment early, we cancel them early.
Okay, so Daktari, before we wind up our show, kuna swali hapa. Daktari, kindly talk about child winning.
Child winning.
I know that's way, but can you mention something?
It's a topic on its own. It's a topic on its own. But at what age are we doing winning? We want it at 6 months. So remember, this mother, whatever we are doing, we want to make sure you have adequate milk supply for this baby who's born, for example, today, until that child is
6 months,
Except in a few situations that I will mention on
a different day.
If you don't have a mother, or a mother is unwell, for example, we deliver a mother, we deliver a baby and the mother is admitted in the ward, we need alternatives. But despite that, we need the breast milk. Now, weaning is at 6 months, and we start gradually. We start on light things that are easy to digest, but they must be clean. And then we go introducing small things. I think it's a topic on its own. If you don't mind, we'll put it on Facebook. We'll
definitely,
and then we'll put it on our TikTok.
All right.
Complications of poor newborn care.
If
you don't take care of your newborn, number one, hachibi, hanyonyi vizuri, hapati maziwa ya kutosha. Kitu atapata cha kwanza ni acute kidney injury.
Okay.
And it is not easy to know that there is acute kidney injury, especially in our small levels of hospital, until we do some tests. But how does a mother know that si tapata hii? Ni kwamba mtoto ananyonya vizuri. 30 to 60 minutes. Mtoto anafaa kunyonya one breast 30 to 60 minutes bila kuacha. Hata akipumzika ni a few seconds anarudi. There is adequate urine output. Mama asiulize ati atajua aje ni mkojo kwa diaper. Akiangalia hapo mbele ataona side ya mbele. Ukifunga mtoto diaper, the front side where the genitalia is, utaona mkojo hapo. They should pass urine many times and the mother should be keen on checking.
Okay.
If they are passing urine well, we are happy. Wanashiba. The reason why I'm not keeping on talking about passing stool is stool is what remains after you absorb. So if your child is feeding well, is breastfeeding well, you'll see urine adequate of it, then you'll see stool. But stool, the one that I'm very keen on is the first two.
Yes.
Number two, they will not get fever. They will not be irritable. Mtoto unamnyonyesha sahi na after 5 minutes ashaanza kulia. It's because hashibi. And we breastfeed one breast. Once we finish, we go to the other one.
Yes.
So that we breastfeed all the milk. The first milk, the fore milk is light, inakaa maji. Then the hide milk is a bit thicker.
Yes.
The thicker one is the one that will, okay, the fore milk that is maji ndio itapatia mtoto glucose. Hiyo ingine that is thick is the one that will give the baby weight. Itasaidia shibe, it has fat, it has proteins, it has all those other things we need. So it's good you breastfeed one, when you finish, you go to the other one. So the other thing we worried about when the baby is not breastfeeding well and there's no hygiene is neonatal sepsis. It's just an infection of the blood that overwhelms the baby, goes to the whole body, and finally goes to the brain, brings neonatal meningitis. Those are very complex situations. And Baku, we lose so many babies in between because one hospital was giving its data, one of the public hospitals within Nairobi was saying they dialyze more than 500 newborns per year. That's a very high number. True. And you can imagine by the time you're dialyzing, this child has come from a health center to a level 3 hospital, to a level 4, 5, all the way to a referral hospital. So there is loss of critical time by the time you're doing that referral because not many hospitals can dialyze newborns. And then number 2, there are many complications of it. That waste that is supposed to be eliminated by the kidney is destroying all organs of the body, including the brain. So we do not want that. Then the other thing we've forgotten to say, if you don't hydrate your baby well, they will get a higher risk of severe neonatal jaundice. And when you talk about neonatal jaundice, there are many causes, but we do not want neonatal jaundice. The mother should know that every day of the neonatal life, within the first 28 days, they check the white part of the eye. If it tends to be yellow, you bring that child to the hospital, you do bilirubin levels, ipimwe kwa damu. Sio ile ati we mama enda ukaotesha mtoto jua. It's nothing like that. Bring that child, we do bilirubin levels. We might not be able to do it in the dispensaries and the health centers, but level 4s we can do. It's an outpatient test. It's available in all the most of the level 4 and 5 hospitals. So that if they're high, we manage them well. Most of the times we treat them through phototherapy. The other modes of treatment when they are very high, which I'll not touch on today. So we make sure we don't get neonatal jaundice. It's part of the newborn care. As you're taking care of the other systems, make sure we don't get neonatal jaundice. If you see it, don't panic. Just bring the child early. Don't wait at itaenda. Hata ukiotesha mtoto jua, vitai, it will not go. So you bring that child, we check the level, we tell you how we will manage that baby.
Wow, ningependa tuendelee sana tena sana, lakini naona kwanza nimekula masaa ya mwelekezi wangu, dakika kadha wa kadha hapo. Thank you so much, Daktari, for coming. Thank you so much. Maybe your final remark as we wrap up the show.
The only thing I would insist for the mothers is taking care of a newborn is not difficult, but it's not as easy. So when you decide to be a mother, just put everything else aside, concentrate on that baby, especially for the first few days. And then you will see if a baby is healthy, the first few days of life, they will be healthy forever. And for those who would wish to contact me, my number is 0729 357 707. TikTok page is 0729 357 707. You can find me also on TikTok. You can send your questions and the topics you would want us to discuss at Dr.Chege. That is my TikTok page. Na nimeshukuru sana.
Wow, God bless you and do you well. Mwelekezi, nataka tuweze kutambua wadhamini wetu wawili watatu, alafu tarudi tukitamatisha kipindi chetu. Thank you so much, Daktari, for coming. God bless you.
You too.